Okay, so I'm Amr Moussa. I'm the chair of the BSET. I'm currently an interventional radiology consultant in Regina, and I'm an associate professor in University of Saskatchewan in Canada. I trained in East of England, particularly Norfolk and Norwich University Hospital, and after completing 6 years of radiology and interventional radiology training, I moved to Canada where I did an interventional radiology fellowship in University of Alberta, and then I was appointed in Regina and University of Saskatchewan as an interventional radiologist. Well, to be honest, during my medical school, I never thought about radiology. My plan was always to do surgery. And then when I came to house job, I found like every rotation I do, I have to go to the radiology department, whether to request a scan or to request a procedure in interventional radiology. And then I started to be interested in radiology, and I arranged 2 weeks of two taster weeks. And during that time, I was very keen to be in the IR suite, and I noticed the variety of cases they do. Acute and cold cases. They serve all the hospital variety of different specialties, and I was very interested to see embolization cases, how it saved patients' lives, etc. And from that moment, I was set on I wanted to do IR. So when I came into radiology training, I was set on from day one I want to do IR, and I was advised by my trainers, to keep a wide breadth and to keep my mind open. So I tried to be a good radiologist and a good interventional radiologist at the same time. And recently, I had an interventional radiology case where, we had a GI bleeding, which was failed endoscopic management. And after completing the embolization, the ICU staff and he had his junior, they were both impressed, and that we saved the patient's life. And I went back with memory 10 years ago, and I was like, yeah, I was in that position at that time, and I worked hard all these years for this moment. I think the first thing is to keep your mind open to specialties. When you come to electives in IR during your vascular rotation or etc., just show some interest. Ask questions. Don't be shy to ask questions. Try to understand what's going. Prepare the case beforehand. Look through the images, etc. Sometimes for some people, I see they just come in and stand in the background, and it's boring for them because they don't know what's happening. But if you put the effort in and you try to learn what's happening, you'll get a lot of outcome, particularly if the consultant doing the case finds that you're interested. He'll spend the effort to explain to you. And keep your mind open when you come to choosing your job. Do a taster week, see how it's like to be in the radiology department, see how it's like to be in your, in the interventional radiology suite. And just keep in mind, this will be the career for the end of your life. So you have to be happy with your choice.